So I'm going to get this session started, and it is going to be facilitated by Warren Newton. He was here yesterday with us. He's with the American Board of Family Physicians and had to go back to Lexington. So this one is a distance session. And then I want to introduce Gordia Bannister and Mary Knabb. They're with the Mass General Hospital and Mass General Hospital Institute partnership they'll be talking about, and Sharnetta Young with CVS Health. So we're getting a little bit different perspectives, acute care partnerships, and corporate thinking about our workforce and talent development. So I'm going to turn it over to Warren to kick this off.
Thank you, Barbara, and to all my colleagues there, this is a workshop that it is painful not to be there, so I apologize for not being there in person. What Barbara asked me to do was to kick this off a little bit, and then, because I'm not in the room, Barbara or others will facilitate the conversation. We've been talking this morning about how we in educational settings try to predict what workforce will be needed. What we hope to do in this session is begin to, and how patients can be involved with it. What we want to do in this session is really go the other way and say what the workforce itself can drive, the health systems and the health workplace can drive what we are producing in education. As Barbara mentioned, I'm currently president-elect of the American Board of Family Medicine. I'm continuing my relationship with the University of North Carolina, where I was most recently the director of North Carolina AHEC. And over the last 4 or 5 years, I've sort of interviewed about 60 hospital and health system CEOs and maybe 200 other C-suite folks, trying to get a sense of what was happening with workforce across a state with 10 million people, 8th biggest state in the country with many competing health systems. And I think the big lessons for me, and I've said something like this at other workshops, is that, first of all, the pace of change and the amplitude of change in healthcare is stunning. The statistics from North Carolina are impressive that over the last 4 to 5 years, we've gone from approximately 130 acute care hospitals down to 8 or 9, and most people think that in a couple of years it'll be 6 or 5. That virtually all physicians are employed in some capacity, and EHRs are spreading across the state. The other issue, and it's also moving very rapidly, is pay for value. Having heard the hoofbeats for a long time and led by CMS at the national level, what pay for value means in North Carolina is that the single dominant commercial insurer, that is Blue Cross Blue Shield, has said we will never again give a contract for a new contract with any raises for fee-for-service. We're all about pay for value. And the state health plan, which is by far the largest commercial employer, has said, henceforward we will do reference pricing, which will have a huge impact on the health systems across the state. The point for this group is there's change coming. It isn't just coming, but it is now beginning to hear. In North Carolina, we talk about hurricanes. This is level 5, and it's also happening very rapidly. So that's the first point. The second point is, all right, what do they need and what do they want to have in terms of workforce? The short answer is they don't really know. There are a few institutions that are beginning to think about that, but I think there's a real opportunity for we in the education world to help drive their understanding. Most of them are trying to deal with the prior questions of how's this going to be financed, what's the governance going to look like, and so on. But I think we all realize that there are new competencies, such as the interprofessional practice that we've talked about here. There are also new professions being formed in this. and that I think this is an opportunity. There's a great deal of opportunity for educational institutions to put their heads to the ground, hear the footprints, and try to produce what will be needed as their graduates come out, as we've been talking about this morning. My final comment would be that at the last time of dramatic transformation of industry, and this is in the United States about 100 years ago with industrial engineering, in those cases, the industry made a decision. They said the higher education is not responding quickly enough to what we need. And the implicit comment was, if you don't do it, we will. And so I think that for those of us in education, that's what we ought to understand, is that this is, as I mentioned yesterday, an existential issue for us. We need to adapt to what the market not just is, but will be. And I think we've got a couple of great examples of today of the dialogue between the workplace and the education, and I'm looking forward to it. So with that, I'll sort of comment and look forward to hearing both our speakers and the discussion that will go with that. Thank you very much.